How's everybody doing out there today? I'm Adam Geiger. Here's another video out there for you. In today's video, we're going to be talking about the piriformis muscle, one of the 6 lateral hip rotator muscles that are deep in or beyond the butt muscle or gluteus maximus, deep in the hip. Those muscles allow for lateral hip rotation, going out this way, away from the center line, and along with your gluteus maximus and other things that allow that movement. And just gonna basically go over a video on working it out and also stretching it out. I'll do a stretch, and the stretches I do are like the ones I'm doing in the other videos on YouTube there. Now, when somebody is having sciatic nerve pain on either leg or both legs, there's 2 things. It's going to be the piriformis syndrome, which is the muscle that could be squeezing the nerve, or it could be the nerve being pinched up in L5 or from the sacrum. It runs down from the sacrum, or the L5 and sacrum, and down each leg, branches off into 3 parts in the calf. When you go to a local chiropractor, they're going to tell you, well, you got a pinched nerve. A good question to ask is, where or on what bone? It could be L5 or it could be on the sacrum. They're going to say, well, it's probably S1, S2, whatever. S1 through S5. Well, they're not really detailing it pretty well. I've learned it from my schooling in that the sacrum are fused together. S1 through S5 are fused together into one, just like the coccyx 1 through 4. It could very well be a nerve being pinched in those bones, or it could be the muscle squeezing on it. And I will show you on a poster here. Alright, you got your glutes up here. This is your gluteus maximus, or gluteus medius, the bigger muscle behind the butt. And this is your piriformis. These are all 6 of your lateral hip rotator muscles behind the butt muscle. But the top one here, your first muscle, is the piriformis. And, it kind of attaches around the sacrum or towards it. Just somewhere in there. And then it comes out to your greater trochanter on the femur bone. So the nerve runs from L5 and the sacrum out towards the hip, and then down. It branches off into 3 parts in your calf, your tibial, and on the front of your leg, your deep peroneal, and common peroneal on the side of the leg for your fibula muscles. If you're confused about this or you are familiar with the nerves, let me just show you real quick. I don't have a nerve poster, so I will show you on my phone if it shows up here. I guess this is a good illustration. See if it clears up. Not too bad. Shows the piriformis up there, that muscle. The yellow thing is the nerve coming down, and it goes through the hamstring muscles, which are the green, biceps femoris and such. Breaks down into the 3 sections. But that's what we're working on here, so we're going to just get right to it. with a personal training background, exercise specialist, I can stretch, do all these stretches. That gives me the strategies to do that, the right away for that. And then being a therapist, you work on the muscles in that. Therapists don't learn the basics of fitness or stretching and anything like that. And then a trainer doesn't do therapeutic massage and know how to work it out. They may be good about stretching you out. Some of them don't even do that. So what I usually do, and you see a lot of therapists doing on you or someone else, they dig their elbow in there and find that piriformis. How's that in there?
Okay.
He's very tight. The piriformis muscles are very tight, but he's not really getting pain. So bring this leg up. You might feel this one. You're digging in, and you're going to yank the leg outward towards you. Relax, just relax. And they'll feel it pulling in there. Feel it?
Yeah.
He is pretty stiff actually, so it's probably a good thing. I think Grandpa here is 85 years old, so whenever I'm stretching him out and doing things, you know, obviously he needs to take some breaks. But, you know, he still needs it to be flexible. Obviously, when you're really tight and stiff, you need stretched out. You need to lengthen your muscles, and then teach your muscles extensibility, or to be extensive, to withstand that stretch or duration of anything, whatever. Being flexible is being flexible. Having good posture and all those things. That's what I'm about. You want to stretch everything. So that's one good way of doing it. You can jam your fist in there. You know, work on it. And then I'll work on the other hip here.
That was really tender.
Yeah, just relax. Don't contract anything. Relax. It's hard for Grandpa to relax here. I try to tell him, you know, let me do stuff here. Just relax. Don't contract. Same thing, digging into the hip or glutes. Well, he had 2 knee replacements. That's why I can't really bring his foot back toward his butt. His quads are very stiff. So that's as far as it gets. He's very stiff on this side, more stiff. I'm just, on this side, I'm pulling the leg out towards me or towards the window. Relax. Yeah, he's very tight in there, but this will be very effective on him. Sometimes this may not help you out, depending on how tight you are. This may not be effective. So if you go to a therapist or a chiropractic office and this is all they're doing on you is trying to work it out, but then it's not effective, you're not feeling anything, what else do you do? Well, depending on what training they got, they'll try stretching and other things, like myself. But if they don't know how, you're not going to get nothing else from them. That's the difference with how I'm running my business, with everything I'm doing. You got to do both. You got to stretch and you got to work it out. You know, muscles are a intrigued thing, or critical. You can never stop learning about muscles or the body, but you can also never stop learning about why it's good to have posture, good posture, and why massage is good. anything holistic instead of taking a pill or muscle relaxers. You're not going to get the same benefits. I'll probably do some more of this after the video, but those are things I would be working on for a longer time. I don't want to drive this video out. Alright, I'm going to have you roll over on your back.
Why don't you go up down my back like you did the other day?
Well, I can, yeah. I'm just trying to do the... I will, I'm just doing the glutes on this for the video. So let's get on your back. I'll just have you turn back over again.
I gotta get off. You got to run again?
There you go. Center it. Yeah, he's very stiff. I mean, this is not a Hollywood video. You can see how stiff he is and what I'm doing here. I want to get a good angle. Let's see. I guess I'll do this leg first. His hamstrings are pretty flexible. You know, they come up about 90 degrees. So I don't worry about that. I do his glutes and piriformis stuff. You know, you don't always have to get on a massage table. You gotta just make sure it's sturdy. Stretching somebody on the floor is better. Just any surface like that, flat surface, that doesn't have a lot of give. If you stretch on the bed, you're not gonna stretch the person very well. On an athletic table, that works too, you know. I have to lock his leg in, so I put it between my legs, bend that up. What I'm doing here is just stretching the legs over. In other videos, you know, I've done that too. Okay, well, normally I would hold that. But what we need to work on is that piriformis in there, so I'm going to turn his foot toward the wall. I might even just stand like this. Try and get closer towards me. Towards me. Towards me. Okay. This is the easier way of doing it. You stand here. I want to move this over so you guys can see. I basically tuck the leg against my body and I turn. I actually hold this other leg here with my hand supported, and his foot or ankle is against my arm, so it's pinned in there. And then I pull the knee towards me. I turn it in towards me. And he's very stiff, so you know, when you hit a limitation, like a soft end feel, the muscles are keeping it from pulling. So you don't push it too much, you just stop where it's at. A hard end feel would be a bone restricting your movement. Bend it up. We haven't done this stretch routine for a while, so you know, we need to get into this routine. You got to keep up with stretching, unless you're born a natural. You know, you're all flexible. You know, more females are flexible than us guys. I would just basically keep working on it. But I'm going to move on to this other leg. Screw towards me now. This end. Doing the same thing, bend the knee up. Body is pinned towards me. My hand is on this leg. And if you can see his foot, I'm taking it like this. His legs should be across his body like this. But, you know, he's very tight. He's 85 years old. It's not going to happen. Someone like my age, anybody who's young, you know, we can do that. You just got to work on it. But keeping his leg up here, and I'm pulling his knee towards me. So if you can see the movement. I try to do the easiest movements, you know, less work, but more effective stretching is the better, the best. I don't always have to get on the table, actually. I can just do stuff like this. Having a hydraulic table makes it a lot easier. And that's basically what I would do, you know, over and over and over. So, you know, we got some more work to do. Those are the stretches. That's the Piriformis treatment that I like to do. Please get on your Facebook if you have one. Type in holistic fitness and massage. And symbol. Use the and symbol, like not the full word of and. And check out my business page. I share many stuff. And this video will be on there besides YouTube, and I got a blog, Adam the Exercise Specialist at blogspot.com, I believe. But it's on my Facebook page as well if you want to find it under like the website link. That wraps it up here. I'm going to keep working on it. Look at my other videos on there, and you know, stay tuned to those. If you're local out there, you know, I'm back in Ohio again, and anybody local around me, you can always contact me. Thanks, and see you later.